It is the students of past and present that make our college what it is. So, as our twin institutes move towards their centenary, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotion will be preserved forever in the form of this reminiscence. I request the tech team to display the GAA membership form. To remain connected to our alma mater and informed about the activities in KEM, including its centenary celebration, we request you to become the members of the Gosumec Alumni Association, the official alumni body of SAGSMC. All the details and this membership form are available on KEM website. Now I request the tech team to display the Gosumec Foundation PPT. Gosumec Foundation was established in California, United States, to give back to our alma mater, which has helped us so many professionally and personally. The website allows you to enjoy nostalgic content, including history of our institution, medical humanities, archives, and much more. This slide shows the web address of Gosumec. At the footer of this website are links to social media accounts, including YouTube, from where you can access the virtual reunions. Next slide, please. This slide shows the mission of Gosumec Foundation, which is connect, contribute with 3 T's and engage. Connect global Gosumec with our alma mater. Contribute to our alma mater's development by sharing the 3 T's that are time, talent, and treasure. Engage Gosumec with nostalgic media on a continued basis and engage global networking. Next slide. This slide shows how to access the Google form. The objective of this form is to connect with each other and the alma mater. Gosumec Alumni Association, GAA, which is the official alumni body at SAGSMC and KEMH. This information will be secured between GAA and Gosumec Foundation and will later be used to create a secure reachable database. Looking forward to Gosumec supporting our mission to connect, contribute, and engage. Now I request the batch coordinator of 1973 OT, Dr. Falguni Shah, to take over the proceedings.
Hello. Good evening, everybody.
Hello. Good evening.
Hello, good evening.
Good evening. I'm happy to see my batchmates here. He's Dr. Mahesh Vadwa, Dr. Veena Dikshit. Now she's Bhatt. We know her as Veena. And Vasanti is there. And I think Mangala will be joining very soon. I hope she's there. Mangala?
Are we all on one screen?
Yes, we are on one screen now.
Yes. We can see each other.
Yes. So
Chaya is there, I think.
Chaya is not there. Chaya is in Brussels. She said because she is not able to join because she's into some important thing over there in Brussels. So she is not joining. Bharti is in Iceland. So it's very difficult for her to there. Yes, Deepak is here. Deepak, hi Deepak, how are you? Please unmute yourself. We can't hear you.
Good morning and good evening to everybody.
Yes,
Yeah,
good
good
morning.
evening.
Good evening to you. Yes.
I'm sorry?
I said good morning to you.
Good morning to you.
Yes, and good evening to you. Yes. Nice to see you all again.
Yes. Thank you for joining in.
Oh, no problem.
Falguni, I have joined in. Yeah, I just joined in, but I don't know when the net will go. I don't know when the net will go.
Please let me see your face, Chaya.
Yeah, I don't know when the net will just stop. So I'm just saying hi to everyone. Okay.
Yeah, but we cannot see your face. Where are you, Chaya?
Yeah, I'm in Brussels.
I know that, but we can't see you.
Yes, she's on the last.
I can see.
Hi.
Okay, hi.
Hi, Chaya.
Yeah, hi. So I will switch off the video and I'll just keep the thing on. Okay.
No. You can keep the video. We want to see you. It's after a long time we are seeing you. Dr. Natarajan.
He's up there in the corner.
Yeah. Dr. Natarajan, I would like to introduce our friend Chaya Navre. She is Dr. Satish Navre. You know Dr. Satish Navre?
No.
Chaya is his wife.
Okay. Now, okay, great to know that.
Yeah.
Okay. Hello.
Yeah.
So he was at this thing. He was into army.
Girl.
Hello.
Yeah. So she has married him.
Oh,
so it
great.
was during GS. So it was one of our like love stories and happy marriage.
So
now
we can go ahead with the proceedings of the meeting of reminiscing your
yes.
days. Yeah.
So we are like batch of 73. We entered a college at 73 and we passed out in 75. So our admission process, as you have said, like we were like entered into the college with very difficulty. We were all skeptical whether we'll get admission or not. But luckily we all got into it. And I was lucky enough to get into it with my sports marks. I was an athlete and I had lots of certificates. So I got about 25 marks on the day of admission and they pushed me to the higher order. And I got on the first day admission. That was this thing. Hi, Mangala.
Hi, hello.
Hi, that's Mangala. Yes.
Hi, Mangala.
Hello.
Yeah. So that, and like let the others also tell their experiences of admission. Deepak,
Yes,
we were together.
Okay, my admission process was like very strange. Before even got into OT, I didn't know what OT is, what is occupational therapy. I could not even remember the name occupational and therapy together. One of my friend, we just were in the campus in our house apartment building, I just passed by and she said, "Oh, Deepak, I know you wanted to go in medical, but your percentage was not great. So where else have you applied, and then I just told her all the hierarchy from medicine to dental to pharmacy to microbiology and etc. And there was no therapy in the hierarchy. So, and she said, "Oh, have you applied for this therapy?" I said, "What is that?" So, because I didn't want to do a simple BSc, I wanted to do either medical or something paramedical or with the something with the paramedical course. So ultimately, anyway, so I told my friends where it is, and so it's in Parel. I used to be in Ghatkopar. So I went all the way down from Ghatkopar to Parel to just apply for and I didn't know where this college was. I was just asking, and we just walked down there from Parel station to KM Hospitals, GS Medical College. And that's where, I applied, and I applied for I saw only one therapy. So I applied for one thing. And then I went to Falguni's husband's house, Ashok's house. We both were friends. Ashok is our common friend, and Falguni also was our friend from the college life. So I said, okay, let me tell him also that, this is a therapy course, if he wants to apply. So I went there. He was not there. His father told me, no, Ashok has applied it. I said, that's fine. Then he said, did you apply for OT and PT? I said, what is that? I said, I applied for only one. I don't know what I applied for, physical therapy or occupational therapy. I don't know. So then he said, oh, there are two different applications. So I went back from Vidya Vihar to Parel again. And I asked the clerk over there, said, oh, I would like to see, I was here like maybe 2 hours ago, that, what course I've applied. So she was good enough to fish through it and find the application. So, oh, you applied for physical therapy. I said, I would like to apply for other therapy. I didn't know occupational therapy, So he said, okay. So she gave me another form. I just on the spot, I just filled it out. This was the last day before the cutoff date. And then I applied, then the rest is just a story, because then I was 83rd on the waiting list or something. But the way waiting list was opening up, because everybody ahead were going in medical, then they're going to dental, and then they're going for pharmacy and etc. etc. So somehow my name kept on moving up, and then I got a call, and the rest is a history, But then I just got it in, and at that time my father was telling me, he said, oh, we have never heard of this course, what are you going to do after becoming this, etc., etc. Because my father also didn't know about it. I said, I don't know anything, but at least it's a paramedical course, and I just want to get in, I don't want to just do the simple BSc or Bachelor of Science at that time. So that's it. My story is done. And that's the rest of the history. I'm here, happy and proud to be an OT, and very satisfied with my profession, as well as whatever this profession will teach me in my life, personal life, as well as my personal growth, family growth, and everything. I cannot get over with telling how much I'm pleased with my profession. Okay, thank you. I'm done.
Anybody else who I would want to share their experiences?
Veena?
Okay.
I got in the first day only, so no problem. I was happy with my choice.
We have
Really, its admission taking process was difficult, and we didn't know anything about OT. Veena's cousin was there in medical in GS. So she said something is there, new therapy session, two professions, you can try there. I wanted to take something medical, Ayurvedic or dental, and this process we applied. When we didn't get anything response, I started my BSc in Bhavan's College. After 15 days, I got the letter that interview is there. You come for interview. Till that time, when we took admission, I was not knowing about occupational therapy, anything about it. And really, we are proud that we are the occupational therapists and we treated. I was there working in Mahatma Gandhi Hospital Parade for 35 years. I treated all variety of hand cases, hand injury, industrial hand injury. And really, I was happy in my life.
Yes, what are the other memories? Yes, Chaya?
I want to just share something that I had decided not to go for any medical this because there were some 2-3 ladies in the family who were not practicing, and every time everybody would say that you have wasted a seat. So I thought of a paramedical this, and my vocational test, which was done in the school, said that I had inclination for medical this, but at the same time I was good in art and this. So they said, why don't you take up occupational therapy? This was in 10th standard. So that was the first time I heard about it. And yes, then the ball kept rolling. That is a thing. And I realized the importance of it when we were in Assam, in Guwahati. And the Spastic Society people came over to ask me to join them because they said the whole of Northeast, there is no therapist. And it was a real good exposure, not only for spastic, but then the Neurological Sciences Center called me over there because there was no therapist over there too. So it was really helpful for them. And though I didn't know the language, they would just say, Bombay ki lady aayi hai, Bombay ki lady aayi hai, and that made a lot of difference. And
and because Satish was with you.
Yeah, Satish. I was in Assam because of Satish only. So
yeah, but then Satish was there. Where was Satish?
When he was first not allowing me to go and work in Assam because of a lot of political problems. He said, do not go and work outside. You work just, patients, whoever came, he would just say, yeah, she'll tell you what the treatment is. I wouldn't be practicing anything. But when these people came home, he said, yeah, I think you should go. You won't believe it. The first day I just went to visit them and the school, there was a political murder. So in the bus, we were all asked to get down. And also, again, the same story at home that will you be able to do it? But then I had said, yes, I can do it. And even standing on the bus stop, opposite, there used to be people with Sten guns and all. It was quite experience.
Scary.
Yeah. But yes, managed it. That is the thing. And after that, of course, we came to Bombay, we went to Delhi, then Pune. Everywhere was better cities. And I always remained with the spastic or special schools called at that time because they were always in need of therapists and I could keep changing from one place to the other. That was my experience in the profession. So 25 years, then I worked only for special children.
Yes. Yes, Veena, you worked with Navy.
Huh?
You worked with Navy, isn't it?
Yeah, but are we talking about the admission procedure or we are going further? I finished with the admission. So if there are questions ahead, then
no, we can go. No problem. No, nothing in order.
Okay.
Mahesh wants to.
Can't hear you.
Mahesh, unmute.
Okay, I got it now, I guess.
Now
yeah?
you
Okay.
can hear.
Everybody had positive admission admission experience, right? Somebody was suggested by someone. Mine was the other way around. Okay. I didn't want it to come to occupational therapy because I felt it was not up to that MBBS level as in those days in 1973 that we are talking about. However, my friends joined medicine and I joined OT. Now the story is just reverse. Now I'm very happy and settled, and those students who did MBBS are far below me in their financial status. So here I go. I'm the other way around. I hated to join it, but I'm now enjoying my experience. Thank you.
Can I say something?
Yes.
Please.
Yeah. Okay. I was introduced to occupational therapy by my cousin, Dr. Dilip Godbole, who was working with Dr. Bapat. And he said, don't go anywhere. This is a good profession. It has a big not just one kind of patients you will be introduced to. So, and I'm glad that I did it. And it has really enriched my life as well as the patients I treated. And I'm really happy that I chose this profession. Thank you.
And I would like to mention about our teachers also. We had Dr. Rui Fernandez, Dr. Samsi, Dr. Dungaji, but Dr. Rui Fernandez was like, we used to wait for his lectures and we used to all admire him. And I was quite lucky enough to be with him for many years till we lost him last year. I used to be with him for the conferences because my husband is a dermatologist. So Rui Fernandez used to be there for all the lectures, for all the conferences, for all the tours, picnics. We used to go together. And I used to really feel great, that I'm with our friends will also be saying that, we used to, नहीं रूही का lecture है, चलो class में जाके बैठो करके.
We really had great. We had great professors that really taught us well and built our foundation. So really thankful and gratitude to them.
Yeah, even Dr. Manu Kothari, we were lucky enough to have him as our teacher.
Anatomy. Really,
anatomy and brain.
And we were great to learn there.
So he taught us so well that we can never forget now. So it is that. And I remember meeting Dr. Lopa Mehta also, I would mention, because I was staying in the hostel and I had to take her permission twice or thrice for the College Week committee, which I was a part of the committee of College Week and the picnic committee. So I had to go to her, it was a little difficult for me initially, because I had heard a lot about her, that she's very strict. She's she will not give you permission. How come you don't go to ask her and all that? But then I said, no, let me give a try because I wanted to go to the, help my friends in committee for picnic. So I went to her. I said, I need to go tonight to Aksa Beach because we had to supply all the food material, that is the vegetables, the grocery and everything by ambulance. We had to travel from KM to this thing. By 10 o'clock we used to leave and we came back by 2:30 or 3. So I had to take that permission from her. So, but then she was so sweet, she's saying, okay, no problem, you go, but try to come back early to the hostel because I won't like, that girls staying outside. I said, no, madam, I'm going for this purpose only. I'm not going for anything else. And then she kindly gave me the permission. So, and one more thing is I'm planning to meet her because she is my relative's auntie. So about in a month or 2, I'm going to go and meet her personally. That was my this thing with Lopa Mehta and Manu Kothari. Anybody else would like to share something?
Not me. I'll pass this question.
Okay. Any other memories of KM?
Yes, lots of extracurricular activities around, going to restaurants, movies, tickets, and enjoying the actual, study along with the recreational activities. Yeah.
Yeah.
I must say, participating in Avishkar, and that was for the first time I underwent the selection. And Dr. Deval was the one who was taking the auditions. And then the main program, Avishkar, I had to sing a duet. So Chaya's husband, Dr. Satish, he said, "Whom do you want to sing with?" I said, "Somebody with Mukesh's voice." So that time Dr. Satish suggested Dr. Narayan. And then I was on the stage. I could not believe. I mean, it was fun.
Um, I remember the cultural program by Mr. A great musician and artist. So it was like raining. It was, I think, in June or July. Dr. Jitendra Abhisheki. We were like glued to the seats, and we didn't wanted to leave the auditorium. That memory is still there, unforgettable.
Yeah.
And here, I would like to
talking about-
mention 1 minute about the great harmonium player, Dr. Vidyadhar Oak. That time he was a student, and we had attended some program of his in that Wangmai Mandal. And then, I mean, he's a very famous personality now. Then that time he was a student. So, I mean, we had the privilege to listen to him at that time.
One of the cultural programs, I think I was as a volunteer, I was standing over there. And then like Rajesh Khanna was the chief guest over there. And then somebody announced my name. And I was supposed to give to some other guest. But then somebody announced my name that now Falguni Kapadia will give to present the bouquet to Rajesh Khanna. I was so stunned. But then I didn't want to miss that opportunity. So I went and met him. I shook hands with him. And then the people were out, अरे अभी तो फाल्गुनी 10 दिन हाथ नहीं धोएगी अभी फाल्गुनी ये फाल्गुनी वो it was a big thing which was happened, and I really enjoyed that whole thing, and I'm really happy that I could meet a personally Rajesh Khanna and shake hands with him. That was my experience with that cultural program.
Falguni, can I add one more line? I think you're very magnetic to a film industry. Even now, 50 years later, you met this person on the stage and danced with him.
I danced with Anil Kapoor. Yeah,
Anil Kapoor. Okay.
Thank you, reminding.
And I'd like to end. So give me 1 minute whenever you want to end. It's probably approaching 6:30. That is why I'm asking you. I'd like to give my one comment.
Yeah, here till 7.
Oh, till 7. Fine.
Till 7.
Then I'll probably finish my talk because I may have to leave. I thought it was 6 to 6:30. Anyway,
yeah.
I joined in 73, passed out in 75. Maybe the October batch was very naughty and did not attend regularly. 25 years later, the dean had handed over the the certificates to us, and I was called 25 years later when the OT school had 25 years celebration or something. I'm not 50 years celebration
50 years.
To be a host and provide the certificates to the students. So I mentioned there that when I had got the certificate, I was told by the dean of the hospital at that time that OTPT are just ornaments of the woman. Even if they are not existing, the patient will survive. And I mentioned, yes, they are the ornaments of the woman even now, 25 years later. But show me one woman who is happy without the ornaments. So all surgical procedures, medical procedures do require the therapy. This was my approach to the therapist. Thank you.
Excellent.
Yes.
On the same note, Mahesh, when I was operated in 96 by Dr. Ravi Bapat, because Satish insisted it has to be in KEM only, and only Dr. Ravi Bapat will do. That was a gallbladder operation. And on the first day itself, he had told me, I'll give you a side room, I'll give you a good this, don't worry, and all that. And he came. And he said, have you walked on the day of the surgery? So I said, no. He said, you are a therapist. You know the importance of it. So you have to get up and walk today itself. So I said, okay. So first he made me just walk around the bed a little bit. But after that, the whole night, I wanted to pass urine, and the whole drip, Satish would take it out and I would go 2 steps up and down. He said, tomorrow you want to go home, because after that surgery, he had said you can go home the next day. He said, if you want to go home the next day, you will just do what your job is. That is
superb. Real application of occupational therapy in activities of daily living. Superb.
Yes. So he insisted, and I took it up as a challenge, and I said, whether the pain so from ML, this was outside the main theater, the JMT. From there, I walked down the steps, came to the car, and walked up 2 stories to my house in Mahim. That was post-surgery, the next day itself. So
yes.
At that time, I realized.
I guess practice made you perfect.
Yes. And even now, when I was not well, I think our therapeutic brains work faster when we have to do a few things. They do work faster. So, yes, it has helped personally as well as professionally, everything.
Yes. Keeps us going.
Yes.
Yeah. And I have some few photographs with me. I think the technical person should present one by one. So we can, I can
sure, ma'am. Tushar,
some more.
Can I share? Ma'am, I will share the screen. 1 second. Ma'am, is the photo slides are visible?
Yes, we can.
Yeah. I just keep as I keep just in the Dr. Falguni ma'am has shared with me.
Sure.
Yeah, this is the Gosumec I have with me, and I have preserved it for the last, I think, 50 years. It's with me from 74 and 75 batch. 74 and 75 years. This is the first page. This is Dr. C.K. Deshpande. He was our dean that time, who gave us admission to this college. This is Dr. C.H. Asrani. He was our good friend and our cultural secretary, whom I personally also helped him a lot in winning his election and helping him out in all the other activities of cultural activities, whatever were there. And I had participated in many of the dramas. This is the photograph of the drama, which was a Hindi play, Ladki Pasand Hai. And please turn over the page. No, this is, yeah. This is that Ladki Pasand Hai drama, where I won the Best Actress prize, and I had made friends with lots of other seniors and my colleagues, I mean, those friends over there in KM. It was really fun doing all these things and getting that actress. In the first year also, I had acted in a Gujarati play, but unfortunately, I had to, I forgot few of my dialogues because I saw my parents sitting on the audience. And I literally froze over there, and I went just cold, and I forgot all my dialogues. Because of that, I missed my Best Actress prize. But the next year, I made an attempt. No, I must get it. And in that Hindi drama, I got again that prize. which I had missed on their first year. Yeah, you can go a little further. These are the these are the other photographs of the play. These people had done in that Ek Bacha, that Mehmood song. They had all, that is Satish Navre is there. Satish is there in this.
I know, Falguni, I had draped the saris for all these
chaps. Yes. You and I did all that makeup for all these boys over there, you know.
Yeah.
Some people had beard and they're saying, "Are idhar powder laga raha hai." Mali tumhara kidhar daadi much mein kidhar daadi lagaya. We were there.
Yeah.
Really fun. Yeah. So I just have this Gosumec. So I said, let me give this photograph so that, you know, even those who are not present in this video, but then they will be watching later on. If they need, you know, we can give them more of these pictures. I have this book with me.
Okay.
Yeah, this is the Dandiya, that amusement park we had.
Yeah.
Garba which we played. I'm there in that very photograph somewhere outside, you know, long time, like just behind this. So I wanted to relive all those memories of Garba and all that.
Yeah.
This was our friend Dr. Valsan. We unfortunately lost him about few years back, but he was very cute and very nice, very short-sighted, but he was very high in spirits and he was very enthu and very active, you know. And he had arranged this picnic, which I was part of the committee. And he really encouraged, you know, saying, "Nahi, tum log OTPT ka girls bhi aane ka hai. Tum log bhi aao." And I took my juniors also with me. And we all went for the picnic and we really enjoyed. This was of food that we served. All these girls, all these occupational therapists and physiotherapists girls, we all stood in line. We served food to them. Though it was a buffet, but then we said, no, we will stand there and serve them, you know, so that everybody can have proper food, you know, not grabbing and nobody rushes into it and all that. And these are the boys who are enjoying in their own masti. And we had that Kawali also of Aziz Naza. Dalta karta hai, dheere dheere jalda aayega.
I remember that. Yeah.
You remember that, na? We all had a very nice time.
Yes.
These boys, they sung so well. Further. And I feel proud that I was into sports also. So those photographs are there. Still further you can go. This was the picnic which we had gone. This was the Mahabaleshwar picnic. I am there in that goggles over there behind, sitting on the boat. And we all had a really nice time going to picnic. And that time those picnics and all we used to go by bus, come back by bus. We had lots of picnics and hikes. I used to always go for hikes. And I feel proud that I have scaled up. I used to go for hikes and we have gone to Kalsubai also. So that was great achievement for me. Because otherwise it's very difficult for us to go on mountains and all that. But then at least these high peaks we can go. Yeah, this is that inauguration of amusement park by Mrs. Deshpande. Further. Yeah, this is the photograph which we had taken. I'm here in the center. In the black pants. Like we were into this committee. So athletics, all athletes were in this. And we had a nice photograph over here. We used to go to Bombay University ground. We used to go to Purandare ground to play cricket, We used to play our athletes, our running race, and all those things. We used to really enjoy. These are the names which are put up for this. This is my photograph. This is my photograph, which was put in the magazine. Dr. Mehboob Merchant, he wanted to have me, like, put in action mein photo mangta hai tumhara. So I don't know how he selected this photograph of mine, but then I'm proud that I was appreciated so much, and I was like winning prizes also. I have lots of certificates from GS Medical College, which are my treasure right now. Yeah. Lots and lots of memories are there. Yeah. Few more photographs, or they are done?
Yeah,
Tushar?
done, ma'am. Done. Finish.
Yeah. Thank you. Thank you very much for the presentation. And how much time?
It's 6:45. You still have time.
Okay.
Then you can go till 7:30.
Okay, okay. Thank you, sir.
You be comfortable. Okay. Yeah.
Pardon?
So that we can extend till 7:30.
No problem. No problem. So anybody would like to share some more this thing?
Yeah, I will say about, like, I worked in OT field, and I was very happy, again, telling my some success story, which I didn't know what I was getting into at that time. When I passed, nobody knew, even in general population in India or Bombay, and I'm from Ghatkopar, like what OT is and what PT is. But I had one clinic of physical therapists in west side of the Ghatkopar. And then he said, okay, I got some job here and there. I was doing part-time, some honorary SIP in Sion Hospital, which was at that time Lokmanya Tilak Hospital. It still is now. And then I decided to join into the private venture. So I said, okay, let me try opening the clinic. At that time, nobody knew what occupational therapy is. So, but still I opened the clinic, and with the word of mouth and with my hard work, dedication, or however you want to say it, and with the support from the community as well as the physicians around, I used to go canvassing, from dispensary to dispensary, and just handing out my cards to everybody. Okay, this is the place I am doing this, everything. So I used to have a clinic in the evening time from 4 to 6. And slowly, it started building up. Then I used to do on my spare time some home visit for home health. And things were getting, response was good. So then I opened another clinic in Ghatkopar only, one in the morning and one, maybe like 3 or 4 kilometers away far in the morning time. So then I had 2 clinics, from 9 to 11, and in the evening, 4 to 6. And then in between and some other spare time, I used to do home health and go from people who cannot come to the clinic. I used to do home health. And it was working out really good. And because Falguni knows, because, then once I got my opportunity to come to US, at that time, my father told me, now you are well established. Now, why you want to go there? Before we know that, okay, in the US, everybody knew that, okay, there is a very good chance for therapy, and they get a good job and everything. But he said, now you are doing equally well. But I said, well, I wanted to see the different country. I want to experience different place. And that was originally I was thinking about. So I would still like to go. And by that time, of course, I was married and everything, but then Falguni was a classmate. So I said, okay, well, Falguni and Ashok both were married by that time. So I said, Falguni, yes, this is what my things are working out. Would you like to take over my clinic, And Falguni, oh, sure, I will definitely will take over, And then at that time everybody was discussing, and then and of course, Ashok, Falguni's husband was also a good friend. Hey, Deepak, don't worry, in case if you go over there and something does not work out, and if you decide to come back, you can always come back, and you and Falguni both can continue your clinic as a partners, And I said, oh, okay, and then the rest is story. I know I go my clinic, running clinic to Falguni, and yeah, we had a good experience and good friendship, and how things unfolds, as go along with your life. Okay.
And I'm still continuing that clinic of yours, not that clinic, but I have got my own clinic now, and I'm still practicing. And I'm very happy that you have trusted me and given me that opportunity to start private practice, individually, like on a clinic.
Right, right. No problem. Welcome. Thanks for everybody. Thanks for mutual.
You are settled in US. You have got a better life over there, or I would say a good life over there, not better. A good life.
I mean, everybody has a good life. Well,
yeah, we all have a good life.
What corner of the world you are at?
Yeah, we are all happy therapists. Yes.
Yeah, because we are all mentally so prepared, and we are so mentally settled, that no
Yes.
matter where we go, we are good, Definitely. So during my last visit to India, Falguni organized everybody to get together, and I had such a good memory of that time to get together with all the classroom mates. It's like mind-boggling that after 40 or so years, you get to see your therapist friends, and when in a college life you're under the tension or whatever you call, that you're like, at that time, boys were not like that much outgoing, or at least I wasn't that much outgoing as Farguni is, so I was pretty much secluded, not secluded, but isolating myself. But I just was very to the point to okay, just to do my lectures, say hello and everything fine, and just go home, do study. And that was my basic thing was. But now once after 40 years, you know, okay, how much thing I missed out by not being so socialized, which Falguni back into the gear and say, okay, now even after this many years, I got to see each other so nicely.
Thank you. Thank you.
I want to say something.
Yes.
Occupational therapy, we see everywhere spastic work with spastic children or psychiatric and all. But I work in hand therapy. I joined MGM Hospital Parade. It's ESI hospital. And that time I realized when I studied anatomy, why we should study the anatomy physiology. If you're working with all cerebral palsy, CP children, or disabled or mentally retarded, or all, that was surely everyone used to work in psychiatry or somewhere. When I started there in MGM, Dr. B.B. Joshi, he orthopedic surgeon, but he was a good in hand. And we used to get lots of industrial injury hand cases. And splint making was the base in MGM hospital. And we have started all that hand splints. And they are famous, Dr. B.B. Joshi's hand splints. And occupational therapy, he used to insist, occupational therapist should work with patient in a ward, not in a department. You should go and see what patient whole day is doing with that hand, injured hand, and you should help them. And that time I realized what is occupational therapy. We can work in which field. And I was the best therapist in MGM, and I was really happy.
Yes, Veena, your Navy experience?
It's more or less like Chaya. I did not practice for 3-4 years, and I did the special course for the spastic children, and then I was all along with the special children, physically, mentally handicapped, and I did my B.Ed in special education, so that could give me a chance to head a school which was run by Navy Wives Association for the special children of Army, Navy, and Air Force. So that was quite a bit of experience. And so I must mention here, I had visited Josna in US when she was in New Jersey, and she used to work in a facility for the senior citizens. And then I could see what the therapists do in a setup like that. So it was a great experience.
Yeah, it was an assisted living plus a lockdown Alzheimer's unit plus an subacute care and a long-term care unit. So, I mean, there are no words to express my gratitude to all my teachers and, who laid the medical foundation plus our OT teachers. They taught us how to be innovative and not just go by a thumb rule. So in US, we used to say OT is not like a thumb rule thing. It is common sense. Use your common sense and move on. Right, Deepak?
Yes, I agree. Totally agree. OT is a vast.
So really grateful. Yes, and I'm really grateful, and my deepest gratitude for our
From our
great
in our
foundation in medical field.
Our application is all.
Like medically, we are so strong because even in US, when I had students, they say, "How do you know so much?" I said, "We had the best professors, we had the best teachers that have ingrained the best knowledge in us and how to use it."
Yeah, Josna, I would like to add to
right
because Dr. Samsi teaches surgery and he used to give us lectures, and his notes, he used to make us literally write those notes.
Absolutely.
And I am really happy that those notes my they wanted our notes. We are not giving that details. Dr. Sams used to come and give us, and we used to never miss any of his lectures.
Yes, absolutely.
I had all his notes, all those my friends who were staying in the hostel, all those MBBS students to take away my, saying, so I feel very nice about taught more about those people.
With my in KM hospital with my plastic surgery department, I had assignment in that, and I'm coming back to Mangla's this splint making. I totally agree with that splint making and the creativity of the OT. I made the one splint was a knuckle bender. Okay, so like MP flexion. At the same time, you wanted to get the PIP extension. So combine this together was like a big challenge. And at that time, we had all the hands-on with the making with the metal wire and aluminum string, giving a padding to those, and oh my God, But I was able to make one splint, and over plastic surgeons were so much happy and amazed, like how I was able to make it like MP into flexions, at the same time trying to get the PIP into extension with the rubber band and leather loops, and they were
tubes also.
Pipes. Tubes.
Yeah, tight pipe. Yeah.
Yes, correct. And then he also at that time there was a Dr. Karmarkar was an intern, and he let me attend one of his surgery, where they were trying to break down the myositis ossification, that is like a formation of the bone in the muscle. And that was for one of the bone patient, has a keloid formation. So they wanted to cut the keloid formation and then cut out this myositis ossification. So they were literally chiseling it out, that bone formed in the elbow joint in the muscles of the biceps. And, and then we had to make a splint for that elbow to get the flexion extension going for that burn patient. So yeah, in India, we have doctors, surgeons, plastic surgeons everywhere. We're like so creative and so like experienced that when I came over here, as Chaya mentioned, yeah, we knew a lot, but like over there, we used to see like in say Sion Hospital, we used to see like a 50 or some patient, 23 or 50 patients, a day. And when I came here, we see like 7 or 8 patients per day. And I said, oh my God, what am I going to do, But here we spend a lot of time in doing paperwork. Over there, we just do the paperwork like, okay, making a tick mark. Okay, patient is here, period, Unless there is some changes, you put down like 1 or 2 lines and the life goes on. And everybody were happy, like we have so much of experience with so many people and so many different variety of diagnoses that we over here, people have not even heard of or seen.
Yes, yes. Yes, how much time we have now?
See, technically 7 was.
I think we should be okay like with it. If you, everybody should be okay with it now. Anybody wants anything still more?
Cut off time. Am I audible?
It's a whole lot of nostalgia when you
And
go to
physiotherapy.
Parel area. And I just really love to be in the campus. I just love it. I just see the building and just have a chakkar inside, and I am very happy.
We went once, we went to college, we
Yes.
went down whole of the canteen and the departments and everything.
Yes,
And
yes,
we
yes.
missed about, even Sahyadri we went.
Yeah.
Sahyadri, we went to this an Irani shop, Irani hotel restaurant. वो भी miss
It used to be, National Chemist used to be a Irani restaurant then.
Omelette pav, bun maska or chai.
All good memories, all good memories.
All good memories, yes, yes.
And even Tata Cancer Center, we used to go right to our OT school. We used to get cheaper chai and cheaper nasta, with a discounted rate.
Yes, Tata.
Tata Memorial Cancer Center or something.
Canteen used to be fun. And, but
Yeah,
our
the canteen
canteen used to be fine, Like
excellent.
We used to go 3 or 4 of us, and then somebody used to again come in, or ek chai leke aao, or 2-3 people used to come, or do.
We used to go to the ladies' hostel to have lunch.
Or ek.
We used to have lunch in ladies' hostel. I remember that. Me, Mangal, we used to go to the ladies' hostel for lunch.
These are the good memories, yes.
I stayed for 1 year, but then first year, very good memories, all those memories are still there.
Yes. And good memories, and we are so thankful.
Any memories of orthopedic center building?
Oh,
any memories of orthopedic center building?
Oh,
yes. I have met Sunil Gavaskar over there.
We used to have that Pawar Sahib. In our workshop, we used to have Pawar Sahib, if you know. He used to loom ka jo in charge he used to be, So he used to see the palmistry, So during the lunchtime, we'll get around with him. And then you say, okay, mera haath dekho. To bola, Deepak, tu kabhi aisa सीधा खाना नहीं खाएगा. Tu always ulta हाथ कर से खाना खाएगा जरूर, लेकिन सीधा नहीं खाएगा. Means whatever work I do, you always find some way to go like a longer way instead of just getting the straight work done, And they say, तुम्हारा खाना कभी भी time में नहीं होएगा. You will be always late in the lunch or the meal में भी ऐसा हाथ देख के वैसा बात. कभी sometimes I feel like, those things are still true though,
Orthopedic center was like a home to us, and we were a very big family. That kind of a feeling we used to get.
My mem-
Yeah, we used to go for, I used to get my dabbas from Thane. I used to stay at Thane.
Tiffin wala.
My mommy used to send me dabbas. Tiffin wala. And then if we used to go for movies, we had to request our friends, you know. वो अपना ओटी का जो कॉमन रूम है ना, उधर जाके तुम डब्बा खा लेना, हमारा ये नंबर का डब्बा होएगा, प्लीज वो डब्बा खा लेना सब लोग। खत्म है तो मम्मी को पता चल जाएगा कि हम लोग मूवी देखने गए करके। So and then there was one cat which was always roaming around in that OC center. So we used to always, वो बिल्ली आएगी, अभी देखो वो बिल्ली आ रही है, खाना खा जाएगी करके, डब्बा ऊपर रखो करके। So those memories over there, yeah.
And good memories about our professors, Dr. Ellen Vora and Dr. Bhansali.
Yes.
They were, you know, it was like the first-hand thing. We used to go to the wards, see what is going on. It was a really amazing experience.
And they used to teach us so well, you know, like, you know, it was never that professional, this thing was never there. Nowadays, I feel certain professors are very professional in teaching, but then those people, you know, प्यार से सिखाते थे एकदम.
Right.
And
round.
Very thorough.
Yeah.
Right.
Very thorough.
They used to include us in their morning round.
Yeah, Dr. K.D. Desai, he used to never allow us after 8 o'clock. Meetha used to be there. Nahi, andar nahi jaane ka, lecture chalu ho gaya. Then we used to push him, aisa thoda deo na Meetha. Then slowly after 5-10 minutes, he used to allow us, sneak into the MLT for the lectures. And then Dr. Nagar was there. Then Dr. Ramji, na? What was his name?
Ramchandani.
Ramnani.
Ramchandani for physiology.
Physiology. He used to tell us only one thing, कि if you want to stay healthy ना, रास्ते पे जाके पानी पूरी खा के आ जाओ, तुम कभी बीमार नहीं गिरेगे. That was his favorite dialogue.
And one more thing I need to add is we were never discriminated that we were from OT or PT by the professors. They used to give same knowledge that they imparted to the medical students.
Yes.
And I remember Dr. Desai, he used to make sure we understood each and everything about anatomy. Same thing with Mr. Ramnani for physiology, Dr. Bhatnagar.
Hall,
Basics were so, our basics were so good. Like even if someone wakes us up from a sleep, we know exactly what is asked about a certain disease or certain condition.
Correct.
Right,
I
Deepak?
just wanted to ask Deepak, did we have pathology as a subject? Because I remember some Dr. Desai teaching us pathology. I was not sure whether we had it as a subject or not.
We had it. We had 50 marks paper.
Yeah, because I remember, and Dr. Desai used to come for the lecture, pathology lecture.
Yes. We used to go and see those slides also, but then sometimes, वो WB वो सब कुछ ऐसा सब एक सेम दिखता था. तो मालूम ही नहीं पड़ता क्या देखने का.
Are you referring to Dr. A.P. Desai?
Yeah. Was it Anil Desai? I'm not sure.
I do not know his first name.
But Dr. Desai.
But A.P. Desai wasn't.
No, Dr. Desai. Yes. I still remember his face. He used to wear specs with black frame. And
Yeah, right. And advantage occupational therapy and physiotherapy students had was that in the first year you used to attend wards, if I'm not mistaken. Okay. Which as MBBS students really in the anatomy, physiology, biochemistry. Whereas occupational therapy, physiotherapy, right in the first year you are introduced to the wards. And that's what I'm under impression. I'm not quite sure. So that makes you
anatomy and physiology and psychology. Second year, psychology and all other things also. Surgery, medicine, surgery, pathology was introduced in second year.
But
and we used to
that time we had 2 years course. 2 years. It was a 2 years course.
Yeah.
But did you have to attend wards?
Yes. We had to attend
the first
wards.
year. First year.
treat patients directly.
First year.
And then when we used to go to the wards, those RMOs used to say, "अरे तुम लोग OTPT वाले इधर क्या कर रहे हो? OTPT वाले इधर." हमले अरे हम लोगों को पेशेंट देखने का है, इधर भेजता है हम लोगों को, हमको ये ट्रीट करने का तो तुम लोग OTPT वाले क्यों आते हो इधर? OTPT वाले क्यों? It was a coined word, OTPT. They didn't know who is OTs, who is PTs, but खाली OTPT करते थे वो लोग.
And we had Dr. Tilve for medicine, I remember.
Yes.
Dr. Tilve.
Wow.
And
So
we used to
all-
have the psychiatrist doctor, who was a chain smoker.
And just since you mentioned you shook hands.
Hello. Yes.
Come again?
Hello, go ahead, please.
Yeah.
Meaning since you said you shook hands with Rajesh Khanna.
Yes.
Okay. So since your name Kapadia had anything to do with that?
Yeah. Story. We have Dr. Thakkar with us. Manu, what is his first name? He writes columns in Bharat Thakkar.
Hemant Thakkar.
Hemant Thakkar, yeah. So his sister and Hemant and me, we were good friends, and so we used to sit in the canteen. And then Hemant used to call some few juniors. When he was in third year or fourth year, he used to call the juniors. ये देख ये ना फाल्गुनी कापड़िया है, ये ना डिम्पल कापड़िया की cousin है, वो उसके पास रहती है वो. तो they used to feel really be amazed, कि हाँ, your फाल्गुनी कापड़िया, your डिम्पल कापड़िया की तू cousin है क्या? मैं बोले हाँ. So and then they used to be so much this thing, ये तू हम लोगों को उसके पास मिलाएगी क्या, उसके साथ लेके जाएगी क्या? So it was just a coincidence. My surname was Kapadia, but then this also used to happen in the college.
Yeah. I just remember one incident during our in anatomy. We used to go to the lab. Remember, the first day I stepped in, I passed out because of the smell of the formalin.
Whatever. Yeah.
And I remember Dr. Desai used to be there, and he used to ask, "Are there any questions? Okay, tell me about this, tell me about that." He was so particular. Oh my God.
Very thorough, yes.
I will never ever forget that.
And I remember one incident where our classmate, when after the exam, we used to ask, अरे तेरे को क्या पूछा anatomy dissection, वो ऐसा एक limb लेके, हाथ लेके या पैर लेके हम लोगों को दिखाते थे कि ये you find out this, where are lumbricals, where are this. So one of my friend had answered, they are in the thighs, so we laughed out so much. Remember that?
Yeah, and I also remember.
Who all remember at our time, this Miss Kiran Dholakia, she was Femina Miss India, and she was admitted in the psychiatry unit. I remember that.
Okay.
And
even we have Shanbag, who was there for so many. We had
it happened during our time only, no? I mean, when we were students, the incident occurred that time.
We got admitted in 73, and this incident also happened in 73. But in
same year,
we got to treat her. She used to come to our department. And get that to us, and we were treating her. But it was a very sad thing. But then we had to do our job, of treating her and stretching out all those muscles, everything. It was really something different.
Wow.
And
somebody was coming.
Our department, he had come for his little finger splint, but unfortunately that day it was Saturday. So I told him, you will not get the splint today. You can come on Monday or something like that. That time he was just a budding cricketer. That time in his, I think the initial days.
Yes.
Before he was. Lots of good memories of all the.
No, Dr. Samsi was part of the sports medicine.
Yes.
But
then he used to teach us for surgery.
He used to take surgery lectures.
No, later on for Indian cricket team and all that, we used to
Yes,
make
yes.
We used to feel very proud that our teacher is, like Indian cricket team का ये sports teacher है, means ये है. So we were really feeling very proud. We know him, he was our teacher. So we used to, very proudly. Like even I can tell about Pilu Modi. He was my teacher's brother. I used to learn dancing when I was small at this reporter, Pilu reporter who expired recently. Our Indian cricket umpire, great umpire. So I knew him also very well. So it was nice, meeting such big people and having fond memories of them. So KM has given us a lot. They have given us this respected life in KM GS Medical College. We'll never forget it.
Agree, I agree.
Somebody was commenting about some. Hello. Somebody
Yes.
was commenting about some chain smoker.
Oh, that was
Okay, I missed out.
that was
There was some
Mr. Dungaji. That
Dr.
was the
Dungaji,
psychiatrist.
the psychiatrist. Yeah.
Oh, yeah. During your time, I was surprised, like how the way he used to give.
And
But
his
Dungaji.
brand, that 555 brand, he used to hold that in his hand, the box.
right, that was like mind bending. Especially he was a psychiatrist lecturer, He should know something, right? But at least.
And
Yeah.
and he said, I am a best example of oral fixation.
Right.
Yes.
Was there a de-addiction ward in the orthopedic center building at that time?
No.
Not that time.
There was no, I don't
Later
think for alcohol also it was
and
not there.
behind orthopedic center.
Yes.
Behind there used to be quarters for staff. Hello.
Yes.
Behind orthopedic center, there used to be quarters for staff.
Yes.
I don't remember.
Staff quarters were there behind our this thing.
Yeah.
But then
and the electrotherapy that
bothered to see
Manik
what.
Shahani.
We never ventured there, but they were there. Yeah.
Yeah.
Dr. Manik, Professor Manik Shahani.
Start with few lectures, go to Tata, and then again go out for a movie or something, and then again come back and have 1 or 2 lectures or practicals in KM GS Center, this thing, Medical College. Then again come back and do our practicals in OT Center, and then again go back to some canteen and sit over there.
Doctor is mentioning something about Manik Shani. What were you telling?
No, there used to be an electrophysiology. There used to be a unit by the side of orthopedic center.
Yes.
Now it is not there, but at that time I think it was.
Yes, it was there. That was Mrs. Shahani's husband, who was our.
He was HOD physiotherapy and she was HOD occupational therapy.
Correct.
Husband, wife, yeah. So that time there was no MSc. In fact, I went once to her, saying that we would like to study further. So please do something to get MSc from the university, get it sanctioned and all that. But then she said, no, it is not even on papers now. So you don't have to, you cannot do anything. And then ultimately I went to All India Institute to do my PG because I want to study further. So I did my PG from there, and later on then like this MSc was introduced.
And do you remember our college was celebrating 25 years and we had taken premiere of Sholay. That was in Minerva. We were in second year. That was in 74, 75.
Yeah.
Correct.
Then we have seen, Roti Kapda and Makan of this cultural program ka part tha. तो Broadway में जाके वो भी movie देखा था ना, और Makan. That was
was there occupational therapy, physiotherapy in Sion and Nair at that time, or it started later?
No.
Only it was not that time.
Department was there.
Only
but there were students
after the 4 years.
But there was no teaching
after the 4 years.
Only
at
KM
Sayan and
Hospital.
Nair also. It was only
Okay.
KM Hospital.
And only 40
So
seats.
we
And
have
you had 40
who are
students?
Yeah, 40 students per batch.
GSItes OT students.
No,
Yes.
but Sayan Nair used to have 10 and 10.
Yeah, 10 and
Yes.
10. Had 40.
Mangala, you're
I
muted.
think we
Mangal,
So
unmute.
it's a great beginning for many. Yeah, I hope the remaining batches take the lead from you.
yes,
Okay,
yes.
and
Yes,
present there.
major credit goes to Falguni. Of course,
No, no,
you
yeah.
are the arrangers of this program, but Falguni took the initiative. So that's how
Yes.
we all are here.
Yes,
So
thanks.
together, everyone achieves miracle. Team.
Yes,
Okay.
very true.
And,
Yeah.
Thank
and
you for
when
giving
Yeah.
Thank you
So,
very much.
Thank you very much.
so
Gauri,
should we
thank
start
you.
winding up?
Yes.
pardon.
No, there'll
Yes,
be
yeah.
now. I'll hand back to
Can't hear you.
Gauri, the student representative. Okay.
Yes.
So she will
Yeah.
wind. Gauri, are you there?
Gauri,
Yes, sir.
thank you. Thank
I think
Thank you, ma'am.
Tushar.
you. Thank you, Tushar.
Tushar. Gauri.
Yes, sir.
Tushar, is Gauri there or she left?
Yes, sir. Gauri is there, sir.
Gauri is
Yes,
there.
sir.
Gauri is there.
So I request the tech team to play the
So
reflection
let her
video.
wind up. Okay, good.
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. G.S. Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. G.S. Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book, we as well as the future generations of students will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Now I end the meet with the vote of thanks. We did like to thank our Dean, Dr. Sangeeta Rawat, Madam, and Academic Dean, Dr. Pathak, for their continued support and encouragement. We thank the Gosumec Alumni Association for administrative support, for correspondence and financial transactions, for Dr. Manu Kothari, Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Mr. Maitre for video recordings. Last but not the least, a big thank to you, batch, for their enthusiastic participation.
Thank you.
Thank you very much.
Thank you.
Thank you.
And
Now the
wish you all
record,
good luck.
recording can be stopped, Tushar, now. Okay.
Yes, sir. Yes. Thank
Thank you. Thank you, sir. Bye. Goodbye. Bye, everybody.
Bye.
It was a nice virtual meet. Thank you very much.
Yeah.
Bye bye.